The COVID-19 pandemic continues to cause chaos across the globe. The Department of Basic Education has decided to ban contact sports in schools. This is in an attempt to help curb the spread of the third wave. Joining me now to discuss not only the impact of banning contact sports, but also some alternative ways for children to stay active. The Springbok women's team, Dr. Moshe Magethi. It's such a pleasure having you on the line, Doc. Let's get straight into it. I mean, it's not nice, and that's, I suppose, putting it lightly, for children to not be able to take part in contact sports. But talk to me about the importance of us just taking some time off from that at the moment.
Yeah, thank you very much, and good morning to your viewers. I think, first of all, what the Department of Basic Education has tried to do is to balance. So they have not completely banned sports, but they have said that contact sports should be banned from schools. So obviously, as you said, it's trying to curb the spread of the third wave. Exercising kids is very important, and I guess in the next few minutes, that's what we will speak about. But the positive thing right now is at least they are trying to bring about a balance.
Exactly, and you mentioned, I mean, obviously exercise in kids is very important. The difficulty now is getting your child, first of all, to be motivated to want to exercise, seeing as, you know, the soccer, netball, cricket, rugby might be banned at the moment. What kind of exercises as a parent, or what kind of measures can you put into place to ensure that your child remains physically active over this period?
Okay, so first of all, skills, or rather schools can be innovative. So soccer, rugby, netball, it can still take place as long as there is no contact. So what we have, for example, done in the past in rugby is you can still practice something like passing drills, running drills without necessarily allowing contact, and then also keeping social distance between the athletes. So 1.5 meters at least between the athletes. And then, of course, you also have other sports such as just running, things like tennis that you can engage in. But it's very important that we should strike the balance between trying to curb the spread of the third wave and also keeping our kids active. Right now, as it is, our South African children, at least only 50% of them are engaged in exercise according to recommendations. And so there's a lot that we still need to do to improve the physical activity levels of our children.
Talk to me about the dangers of the reduced physical activities in our children, and also the dangers of this virus, COVID-19, to our kids. Plenty of reports from everywhere coming out, some conflicting. What is your take on it?
Okay, so first of all, there are huge dangers to physical inactivity. It has been shown that kids become overweight, they develop obesity, emotionally and mentally it impacts them to a certain extent. And then we are beginning to see chronic diseases such as diabetes, even hypertension, develop very early in children, something that we used to see later on in adulthood. So just to mention a few, and then specifically when it relates to COVID. In general, COVID does infect everybody, but it's not as severe in children as it is later on in adulthood. However, we know that children are not isolated in and of themselves. They live in families, and so if they get infected and then they go back home and infect their mother or their father, that does create a huge risk for the family.
I mean, the difficulty, Doc, is that, you know, children generally haven't played sport for too long, so they might not have the ability to train on their own. If it is the case that the school entirely cancels, exercise, or rather cancels the sport, including contactless training, what kind of advice can you give to children or parents of children to just get them out and let them be able to exercise, I suppose, in a fun way?
I think, first of all, the advice should be to the Department of Basic Education. Healthy, Active Kids South Africa they published a report card in 2018 which showed that kids are more motivated to exercise when it's done in groups. And so while the Department of Basic Education is banning contact sports, what they also need to do is try and motivate the children to be active in one way or another, even at school. And then two, when it comes to parents, I think community initiatives or community programs where either parents club together, take the kids to a park, maybe run around or something of that nature. They need to try and be innovative so that our kids are not inactive and then they are at risk of developing disease.
And I mean, the risk of developing diseases there, you mentioned the fact that there's a health risk as well. You as a team doctor to rugby players will know exactly what happens when a player cannot take to the field, be it for an injury or whatever other reason might be. I would assume and imagine that children mentally will also be going through a very tough period. How can that be best managed?
Yeah, so how do we manage the psychological consequences of inactivity? I think it has to be a multidisciplinary approach. First of all, you can't just give it to one person. You can't just say, well, parents, here you are, take over. We don't want your children to contract COVID. So school teachers, as I said, you can club together as communities, come together as parents. You can speak to maybe other professionals, physiotherapists, biokineticists, strength and conditioning coaches, just to see how you support the child. But it cannot just be a one-dimensional approach.
Doctor, thank you so much for your time. I really do appreciate you waking up with us this morning. And that is, of course, Dr. Magethi, who is Moshe Magethi, who is the team doctor, actually, for the Springbok women's team, but also a doctor that is part of a group of doctors looking to improve health in all aspects and spheres around South Africa. Right.